Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. I've been taking a series on parotid gland recently, in which I've already covered parotid gland 1. The link for that lecture is given you, it's available. Today I'm going to take parotid gland 2, which means I'll be revising what I've covered in my earlier class and then introducing some very important additional aspects related to the parotid gland. I hope you're ready and you're going to enjoy this class. All right. So let's begin parotid gland 2. Before I start, as usual, I'm requesting all of you to please keep a packet of color pencils, the drawing book, and or any digital drawing implement with you. Whenever I ask you to draw, students, please draw. It's not because I have some great pleasure of making you draw, not at all. But the thing is that when you draw, you use more aspects of your brain in that learning activity. This results in better understanding and better recall. So that benefits you, and that's why this insistence. So I hope you follow my instructions and let's begin our class for the day. Parotid gland part 2. Right. So before we get into this, let's see how much you know. So solve this MCQ please. There's a 38-year-old woman. She's come with parotid gland pain. Okay. The doctor opens his mouth and sees some pus oozing from the parotid duct in the mouth. Okay. Now, what was the most likely anatomical reference that the physician considered to locate the parotid duct? This definitely needs prior knowledge. Nobody can come up with an answer to this MCQ unless you've studied this. All right. Some other questions commonly asked describe the secretomotor supply of parotid gland. Again, prior knowledge needed. So let's then get into this class and get you that knowledge. Okay? Right. So here, a quick revision of what we've done earlier. This is the parotid gland. As you can see, this yellow gland. It's inverted pyramid-shaped structure situated just beneath your external acoustic meatus. Okay? The parotid gland can be studied as coverings, parts, and contents. And then we will be discussing processes, parotid duct, blood supply, nerve supply, etc. So I've already covered the first part of it, coverings, etc. But let's quickly revise these parts by doing a diagram. Okay, a pair of diagrams to be precise. So presenting parts of the gland are apex, base, 3 surfaces and 3 borders, best understood by the diagrams. Right? So please get your notebooks, dear students, and let's begin a diagram. So let's understand the parotid gland by drawing it. Okay. So begin to draw your parotid gland. Draw it nicely, students. Okay. Ensure that the lower end of the parotid gland is pointed. Okay. Now here on one side, this is the external acoustic meatus. The parotid gland is related to it superiorly at the base. Okay. Now take some colors and enjoy coloring up your parotid gland. This lower end of it, which is pointing downwards, is called the apex, and this wide upper end of it is referred to as the base. Right. If you understood the apex and base, let's go to our next diagram, which gives you an understanding of the surfaces and borders. Start the second diagram, please, students. Students, let's begin drawing the parotid gland. Now we are going to draw a transverse section through the parotid gland. Please ensure that your transverse section looks somewhat triangular. Okay. Anterior to this here, the parotid gland is related to the mandible, which on the outside gives attachment to the masseter and on the inside gives attachment to medial pterygoid muscle. Posteriorly, it's related to the mastoid process, which on the outside gives attachment to sternocleidomastoid and on the inside to the posterior belly of digastric. Here it's related to the styloid process, giving attachment to styloglossus, stylohyoid and stylopharyngeus. Further medially, you come across the beautiful carotid sheath containing the internal carotid artery, the internal jugular vein, along with 9th, 10th, 11th and 12th cranial nerves. Further medially, you come across the wall of pharynx. The parotid gland is separated from the surface by skin and by underlying superficial fascia. Now color up your diagram and enjoy the process. Alright students, using this image now, we are going to understand the surfaces and borders. This border, which is directed towards the mandible, is the anterior border. This one directed towards the mastoid process is the posterior, and this one which is directed towards the wall of pharynx is the medial border. Between the anterior and the medial is the anteromedial surface. Between the posterior and the medial is the posteromedial surface, and towards the skin is the superficial surface. Now it's up to you students to further draw by adding the contents. Here you are seeing the facial nerve entering into the gland, passing through it and emerging outwards. Deep to that lies your retromandibular vein. Deep to that lies your external carotid artery. Color them up and complete the diagram. Having drawn this diagram, it will help you a lot to understand the rest of the anatomy of parotid gland. Right. If you've understood the surfaces and borders, then dear students, let's revise the contents. So here in this diagram, you can see the facial nerve which is passing through the parotid gland, dividing the gland into a superficial part and a deep part. This branch, this facial nerve divides into 5 branches. What are the 5 branches? If you've done this earlier, you will be able to easily tell me the 5 branches are temporal, zygomatic, buccal, marginal mandibular and cervical branch of facial. If you recall, the buccal branch then divides into an upper buccal and a lower buccal. This is something you should revise every time you study, students. Don't tell yourself, I know. You don't know unless you revise it. Anatomy is a very volatile subject. Unless you revise, you are going to forget. Okay? Right. So these are the branches we just discussed. The next content is the retromandibular vein. Okay? So this is the vein that is formed by union of superficial temporal vein with the maxillary vein. It gets formed in the parotid gland and finally divides into an anterior and a posterior division of retromandibular vein. Okay? Just understand that very few veins actually divide in the body. This is one of the few that does. Normally, veins unite to form larger veins, isn't it? On the deepest side, you have the external carotid artery and its branches. So what are the branches? External carotid artery enters into the parotid gland from the carotid triangle, dividing into its terminal branches, superficial temporal and the maxillary artery. Sometimes it also gives rise to the posterior auricular artery within the gland itself. Okay. Other contents here are a few parotid lymph nodes and one auriculotemporal nerve. So these are the contents of the parotid gland: facial nerve, retromandibular vein, external carotid artery, parotid lymph nodes, auriculotemporal nerve. Okay. So if you have understood what I have been telling you, let me see if you are able to answer this. Okay. There is some quiz now. Come and see if you can answer. What is this, students? Which nerve is it? It's coming out from the base of the gland. Which nerve is it? It's a temporal branch of facial. This one? Zygomatic branch of facial. This one? Posterior auricular branch of facial. This one is the lower buccal branch of facial. And this one is the marginal mandibular branch of facial. And this one? Retromandibular vein dividing into an anterior division and a posterior division. So this is the anterior division of retromandibular vein. See, it's good to keep testing yourself. This is the only thing that's going to trigger your mind to give you answers back. So if you know this, then let's now get into processes of the gland. Understand that your parotid gland is in a parotid region. So wherever it finds space, it's going to expand, creating what is called as processes. For example, now it has a facial process. That means some part of the gland is extending on your face. This is called as the facial process. A bit of it might just separate out and form an accessory parotid gland. If it goes forward, if you recall our diagram that we've drawn, if it goes forward close to the medial pterygoid, it's called as a pterygoid process. If it goes up towards your TM joint, it's called as a glenoid process. If it goes in relation to the styloid process, it's called pre-styloid or post-styloid processes. Some data has entered your brain. I'll tell you how you'll understand this quickly. Let's go to the next sheet. Now, the names are given and two images are there. The arrow will point out something. You have to tell me which process it is. This is the medial pterygoid muscle. Which process is this? Obviously, is the pterygoid process. This one is going in superficial to the styloid. So it is pre-styloid process. Deep to styloid, post-styloid process. This one is going up towards TM joint, glenoid process. Forward towards the face, facial process. As a separate gland, accessory parotid gland. See, sometimes questions can teach you more than actually teaching you the answers. You test your brain begins to respond to stimulus. Okay, so these are the processes. I don't think you'll have any problem remembering this now. With this, we come to the next, the beautiful Stenson's duct, okay, which is the duct of the parotid gland, emerging from the gland. Follow the image, please. Running over the masseter muscle, piercing the buccinator, draining the saliva into your mouth. It lies between the upper buccal and the lower buccal nerves, okay. This duct is about 5 cm in length and 3 mm in width. From my side, I am done teaching you parotid duct. Let's see how you answer the question. Again, I have another question for you. See the adjoining image and answer the question. The parotid duct lies on, which muscle does it lie on? Masseter. Between which two nerves? Upper and lower buccal. Pierces dash. Which muscle does it pierce? You can see it piercing. Yes, it pierces the buccinator. To open into the vestibule of the mouth. Again, a question has taught you more than any amount of teaching. Where does the parotid duct open? Now, I know that all of you are very good looking, handsome, whatever else you want to be. And so many times you look in the mirror and smile lovingly at yourself, quite approvingly. Ah, nice. Good. Once in a while, it's nice to open your mouth and look inside. Okay, there is something very lovely happening inside. There are two beautiful tonsils and there is the opening of the parotid duct. So do have that curiosity also. Okay, so where does the parotid duct open? It opens in the vestibule of the mouth, opposite the upper second molar tooth. So go looking for your upper second molar tooth. See in the wall and you will find a tiny little opening. Okay, which is the opening of the Stenson's duct or parotid duct. You know, students, this I did when I was in my first MBBS and I was very surprised that I didn't know there was a hole in my mouth in the wall of my cheek. I just didn't know because I, like you, was also busy smiling at myself in the mirror. Never bothered to open my mouth and look inside. Once in a while, it's good to do these things. Okay, right. So that's the Stenson's duct. Applied anatomy is that infection from your mouth can ascend through the parotid duct to the parotid gland, resulting in parotid abscess. See if you can solve this MCQ now. I'm confident you can. Just try. This is the same MCQ we started with. What is the most likely anatomical reference the physician considered to locate the parotid duct opening? This time you know the answer. It's the mucosa of cheek along the upper second molar tooth. The others are just distractions. Alright. So this is also an important applied anatomy. Right. So with this, another applied anatomy related to Stenson's duct is that sometimes there is calculi formation in the duct. So parotid calculi can be formed in the gland or can be formed in the duct. In which case you can do what is called as a sciallogram and see where the stone is stuck and where it is creating obstruction. You can also do a bidigital examination of the duct. You can feel the duct in the wall by using your two hands to hold the duct in between. Okay? Right. So we now come to the blood supply. Remember one thing. When your friends come to your house, does your mother give you food and does not give them anything? It doesn't happen, isn't it? If there is somebody in your house, your mom is going to feed them as well as feed you. The same applies to arteries. If the artery has entered into the parotid gland, it's going to supply it. So which is the artery that entered parotid gland? Yes, the terminal part of external carotid. So that's your arterial supply. Similarly, vein formed is the retromandibular vein. That's your venous drainage. Common sense. You needn't mug up everything. Okay? Right. We now come to a very important aspect, which is the nerve supply. So the nerve supply consists of parasympathetic, sympathetic and sensory. Here I need you all to focus. Maybe you can have a sip of water, coffee, something, but I want your full attention now. Okay? Right. Ready? Okay. So, the nerve supply responsible for controlling secretion of saliva is called as secretomotor. It is causing secretion. This comes from two systems, the parasympathetic supply and the sympathetic supply. Both parasympathetic and sympathetic consist of preganglionic and postganglionic fibers. Suppose this is a ganglion. There will be fibers which are preganglionic, there will be fibers which are postganglionic. Okay? The preganglionic will relay in the ganglion, postganglionic will then go from there to the target organ. I'll show you images, it will help you to understand. Right. So I can see a beautiful diagram here. I love it. Okay. Here is my brain stem consisting of midbrain, pons and medulla oblongata. Just imagine that I have seen something very tasty. I am especially fond of chocolate cake. So I have seen a chocolate cake. Okay. And my mouth says, okay, let's have saliva ready to chomp on the cake now. Right. So my brain has seen it. My brain has registered that yummy. Okay. And therefore, my inferior salivatory nucleus in my medulla has got stimulated. Inferior salivatory nucleus says, I want to go to parotid gland here to stimulate salivation. How do I do that? Nucleus ambiguous right next to it says, my glossopharyngeal nerve is out on the way out. You can take a hike with it. You can take a lift with it. So the fiber from inferior salivatory nucleus begins to travel with my glossopharyngeal nerve. Understood? Inferior salivatory nucleus fiber has started to travel with my glossopharyngeal nerve. Soon the glossopharyngeal nerve gives rise to a branch called tympanic branch, which goes to my ear. In the ear, it forms a plexus called the tympanic plexus, from where a nerve emerges called as lesser petrosal nerve. I am sure all of you have heard of this nerve. The lesser petrosal nerve now passes through foramen ovale. Now that's your favorite foramen, isn't it? M-A-L-E. Okay, the L part of it is our lesser petrosal nerve. Passes through the foramen ovale and then goes and relays within the otic ganglion. So these fibers are before the ganglion and therefore referred to as preganglionic. From the otic ganglion, postganglionic fibers now want to go to parotid gland. Who is going to parotid gland? It's the auriculotemporal nerve which is going to parotid gland. So now they take a lift along with auriculotemporal nerve, reach the parotid gland, causing watery salivation. So when I saw the chocolate cake, all this happened, and that is why I had pooling of saliva in my mouth from the parotid gland. You must understand and imagine this. Then it becomes easy to remember. Right. But this saliva is too watery. I want something more viscous. That's where my sympathetic supply will come in. Okay. Can we revise this quickly, students? From the brainstem, okay, in the medulla oblongata, there is a nucleus called inferior salivatory nucleus. Stimulus from here will cause salivation. Fibers from here travel along with my glossopharyngeal nerve, which gives rise to the tympanic branch, participates in the tympanic plexus, from where the lesser petrosal nerve begins and relays in the otic ganglion. These fibers before the ganglion are called as preganglionic. Fibers from the otic ganglion now travel to parotid gland through auriculotemporal nerve. These are postganglionic and they bring about stimulation of parotid gland with secretion of thin, watery saliva. Right. So now let's go to the next image, which shows that from T1 fiber, from the T1 cervical spinal cord, T1 spinal cord, fibers emerge which go to the superior cervical ganglion. Because they are before the ganglion, what do I call them? Preganglionic. From here, postganglionic fibers form a plexus around the external carotid artery and its branches, and these fibers finally pass through the otic ganglion without relay. Why are they not relaying there? Because they've already relayed in the superior cervical ganglion. So they are postganglionic. They don't have to relay again. They pass through the otic ganglion now travel along which nerve? Again the auriculotemporal nerve and relay in the parotid gland. What kind of secretion has happened now? Thick mucoid saliva formation. So one is causing thin secretion, one is causing thick secretion. The balance between the two results in the optimum viscosity of the saliva that is there in your mouth at any time. Okay? Right. So now talk about sensory supply. From my parotid gland, sensory supply goes to my brain through two nerves. One is the auriculotemporal nerve and the surface is supplied by the great auricular nerve, which carries sensations from here, from the angle of the skin over the angle of mandible to the brain. So parasympathetic, sympathetic are both secretomotor. Sympathetic is also vasomotor. And the sensory supply is carried by the auriculotemporal and great auricular nerve. So now we come to an important Viva question, important MCQ. What is Frey's syndrome? This is amazing, okay, students? It is so beautiful. Just understand it and see the beauty in it. Don't try to mug it up. I'm sure you're not going to remember it that way. Right. So this is just for you to read later and I'm not going to read it. Right. So let's see what happens normally, okay? This is the parotid gland. This is the postganglionic parasympathetic fiber which stimulates the parotid gland to cause salivation. Correct? Now what happens? This is the skin over the angle of mandible. This is stimulated by the greater auricular nerve which causes sweating in it. Okay? So this is all normal. Now what happens in this person? There is a damage to the parotid gland. Some kind of trauma has happened and postganglionic fibers are cut. Okay? As they are healing, they get attached to the greater auricular nerve. Instead of getting attached to their own fibers distally, they get attached to the adjacent greater auricular nerve, which is also cut. Now what happens? Whenever there is stimulation to salivation, for example, I saw the great cake, chocolate cake. So what happens? Now the stimulated parasympathetic fibers stimulate the great auricular nerve to cause sweating on the surface of the face. So isn't that amazing? That when I'm seeing chocolate cake now, instead of salivation, I'm getting sweating over my face. This is called as Frey's syndrome. The malunion of the postganglionic parasympathetic fibers with the great auricular nerve, which therefore takes the stimulus to the skin instead of taking the stimulus to the parotid gland. Okay. So this is called Frey's syndrome, asked very often in MCQ. Students, do take time out to understand this. Okay. Finally, we come to a lymphatic drainage. This is via the parotid lymph nodes, which drain a large part of your scalp. Please use the lines to understand which part of your scalp and face is drained by parotid lymph nodes. Okay. So with this, we complete the topic of parotid gland. I want you to solve this MCQ now. Which nerves carry postganglionic parasympathetic fibers to the parotid gland? Now, this is a question which needs you to apply your mind. I am not going to solve it for you. I am confident you will be able to solve it yourself. Loss of sensation over the temple, loss of secretion from the parotid gland is due to the injury to which nerve? Great auricular, Would it cause secretion in the parotid gland? No. Auriculotemporal? That's a possible answer. Chorda tympani has nothing to do with your parotid. Pharyngeal branch of vagus? Same thing. So what is the answer? Auriculotemporal now. Okay. Sound knowledge leads to correct solving of MCQs. No mugging will help you here. Right. These are some additional questions related to parotid gland. I'm just putting them there for you to kind of test yourself. Okay. So finally, we end my series on parotid gland, part 1 and part 2. I'm requesting you to see both. If I have to have the satisfaction of having taught you the topic well, then I need you to watch both the videos. All right. The link for either of them is given in this at the end of the lecture. I love taking this class, especially, okay? I want you to find joy in this lecture just like I did, all right? And then I hope to see you across some other video some other day. Meanwhile, work hard, dream big, and never give up, my dear students, okay? Thank you so much.